And on this May 1st, many nurses nationwide took part in an event called May Day as part of International Workers' Day, demanding more personal protection equipment, or PPE, at their places of work. The movement happening across near 140 hospitals in 13 states, representing more than 95,000 nurses. That's according to the group National Nurses United. At the local level, the event was held outside Corpus Christi Medical Center's Bay Area Hospital near SPID and Rodfield Road earlier tonight, where we heard from CCMC registered nurse Kimberly Smith, who told us the need for more protection is constant.
Better to have too much than too little. That way, going in, we can feel like we can be the safest we can be. That the PPE, the N95s, that everything we need is right there. It's available to us. We're ready to keep ourselves safe and keep the community safe.
We also spoke with a critical care nurse practitioner in the ICU at Corpus Christi Medical Center, and says his staff and the center do have the supplies and the capacity to keep staff and patients protected.
Been on the front line here at Corpus Christi Medical Center since day one of this pandemic in the ICU with our COVID-19 patients. And Corpus Christi Medical Center has more than exceeded our need for personal protection equipment for myself and the staff.
The hospital releasing a statement in response to the May Day event as well, stating in part, quote, "Since the onset of this global pandemic, which has strained the worldwide supply of personal protective equipment, Corpus Christi Medical Center's goal has been to protect our frontline clinics and caregivers so they are able to continue to care for our patients and community. Meanwhile, this union is trying to exploit the crisis to advance its own interests, organizing more members," end quote. We have that full statement online for you at KIITV.com.